Welcome, everyone. Thank you for joining us today. I am Dr. Arianne Teherani, Professor of Medicine and the founding co-director for UCSF, new Center for Climate, Health, and Equity. Today's session is the second of a three-part speaker series we are hosting to engage our community working at the nexus of climate change, health, and equity. At our March 18th session, we explored the urgent health threats of wildfires with a focus on California. And in today's session, we will assess the interconnected and compounded health effects of climate-driven food insecurity and migration. And at our final session on May 20th, we will discuss how to capitalize on synergies between climate, racial, and the health justice movement. This series is being co-hosted by the Office of Population Health and Health Equity in the UCSF School of Medicine and UCSF's new Center for Climate, Health, and Equity. I also want to thank our collaborating partners on the series, the UCSF Earth Center, the UCSF Office of Sustainability, and the UC-wide Center of Expertise on Planetary Health, as well as our Planning and Advisory Committee for the series. Now we'll hear from Dr. Sheri Weiser, who is co-chairing the series with Vice Dean for Population Health and Health Equity, Dr. Kirsten Bibbins-Domingo. Dr. Weiser is a professor and internist in the Division of HIV, Infectious Disease, and Global Medicine in the UCSF School of Medicine and is working with me as the founding co-director of UCSF's new Center for Climate, Health, and Equity. She is a leading international researcher on food security, social and structural drivers of the HIV/AIDS epidemic, and more recently on the links between climate change, food insecurity, and infectious diseases. We have worked together closely to spearhead educational initiatives across UCSF and the University of California system to incorporate climate change and sustainability into health professional education. She will give us introductory remarks and will also moderate today's panel discussion. Welcome, Sheri.
Thank you so much, Arianne, and a warm welcome to everyone. So we know that both food insecurity and forced human migration are unfortunately among the most harmful consequences of the climate crisis. We expect that there's going to be at least 200 million climate migrants by the year 2050. And what this means is that 1 out of every 45 people in the world will have been displaced by climate change. And much of this is going to be happening within resource-poor countries that may lack the means to absorb such unprecedented population shifts. At the catastrophic warming levels of 2 to 4 degrees Celsius, migration is going to become an imperative for survival. That today 1 out of 9 people in the world are hungry, and that climate change will increase this number by 20 to 50% by mid-century. We know that climate-related food insecurity disproportionately impacts people of color and also vulnerable populations like women, elderly populations, children, and refugees. Climate change can influence migration directly, for example, through forced displacements from sea level rises and hurricanes, and also indirectly by amplifying the social, economic, and political drivers of migration. And just as an example, massive crop failures and livestock death we know can disrupt people's livelihoods, which then increases pressures on communities to migrate to find food and work. The largest populations at risk for being climate migrants are in Asia, Africa, and Latin America, and also in the small island states, which have vulnerable geographies like low-lying coastal zones. And there may be actually gender differences in climate-related migration. For example, Adrian Epstein and our group conducted a recent analysis using demographic and health survey data from over 400,000 participants in 23 countries in sub-Saharan Africa. And we found that women had higher odds of short-term migration in both conditions of drought and excessive rain, but there were no associations for men. In terms of food insecurity, climate negatively impacts all dimensions. It affects food availability by increasing crop loss, animal death, and migration of fish. We see reduced food access through its economic impacts, such as income loss and unemployment. Climate change contributes to reduced food utilization through worsened diet quality, and we're going to be hearing a lot about that from Dr. Myers, as well as food and water contamination. And finally, the stability of the entire food system is compromised through climate-induced market volatility, as well as political instability. So as an example of how climate change affects nutrition, in a meta-analysis led by Mark Lieber in our group, we found that drought conditions were associated with 46% higher odds of both wasting and underweight prevalence. And in separate prediction models, we estimated that climate change is actually going to increase the prevalence of malnutrition by greater than 50% by the year 2050. So the quotes on the right side are from a qualitative study in Kenya led by Tammy Nicastro at UCSF. And you could see that participants talked about how loss of crops, animals, and income related to extreme weather events worsened their food insecurity and diet quality, and also contributed to weight loss and stunting in their children. So while this figure is oversimplified, it shows that really food insecurity and migration are important mechanisms through which climate change drives poor health. So starting at the left of the figure, you see global environmental change, which includes things like rising temperatures and sea levels, more extreme weather events, and biodiversity loss, among other things. And these factors can drive both migration and food insecurity, which are also bidirectionally linked. And I already alluded to how climate-related food insecurity could lead to migration. And we know that migration can also increase the risk of food insecurity when people are forcibly displaced, for instance, to crowded settlements after weather-related disasters. Food insecurity and migration in turn can lead to poor infectious as well as non-communicable disease outcomes through several pathways, including worsened nutrition, mental health, gender-based violence, and also behavioral risk factors like expanded sexual networks and poor engagement in care. So UCSF investigators have led a large body of research showing that food insecurity is associated with really poor health for many conditions. For example, we found that food insecurity is associated with worse HIV outcomes along the entire cascade of care, from HIV acquisition to worse virologic outcomes to HIV-related mortality. And we also found food insecurity is associated with other STDs and higher Ebola virus-related mortality. Food insecurity is also associated with chronic diseases like hypertension, diabetes, coronary artery disease, chronic kidney disease, and obstructive airway disease. And finally, we and others have found that food insecurity can contribute to mental health problems and neurologic problems like cognitive decline, migraines, depression, anxiety, and substance abuse disorders. Climate-driven migration also has negative health impacts. For example, we know that infectious disease outbreaks are quite common within refugee camps and in crowded settlements. Disruptions in livelihoods and social networks can also put people at risk for things like malnutrition, STDs, poor mental health, and gender-based violence. For migrants who move from rural to urban areas, there's an increased risk of chronic disease due to both lifestyle and diet changes, and also disruptions in healthcare access. And I just wanted to point out that mobility can also provide a path to health improvement for some. So if people find freedom from violence, a reduction in food and water insecurity when they move, and access to better quality healthcare. And conversely, immobile populations who live within areas that are facing climate threats may actually fare worse because of their inability to leave. So acting on climate change can really be the greatest global health opportunity of this century. And this is because we know that there are critical health co-benefits of climate change solutions. So as we'll be hearing from our panelists, these solutions can span different levels, from macro level business, energy, and policy solutions, to reduction in food waste and promoting the planetary health diet, to micro level strategies that can really foster climate resilience in affected communities. And just for some examples, we worked with Valle, which is a community-based urban gardening organization in San Jose, to address food insecurity and diabetes health among immigrant Latinx families. And we also worked on a totally different water irrigation agricultural intervention in Kenya called Shamba Maisha, which aimed to improve food security and HIV health in communities affected by drought. And interestingly, these very different interventions improved health through similar pathways of improved nutrition, empowerment, mental health, and access to care. But we also learned that solutions really need to be adaptable to unanticipated and shifting climate challenges. For example, in Kenya, our water irrigation intervention worked wonderfully for drought. But when weather shifted over time to more excessive rains, then crops were flooded and eaten by hippos. So we had to come up with different solutions, such as digging trenches to keep the hippos away and considering future crop loss insurance programs to protect against flood damage. And finally, it's important to point out that the most innovative and equitable solutions come from grassroots efforts within affected communities that really center local knowledge and leadership. So today we're going to be hearing 2 short presentations, followed by a panel discussion that I will moderate, and then closing remarks from Dr. Kirsten Bibbins-Domingo. Our panelists bring a variety of perspectives. Dr. Ram Ramanathan is going to give us a call to action on the health and human dimensions of the climate crisis. Dr. Samuel Myers will be using a planetary health lens to really explore the links between climate change, food insecurity, malnutrition, and poor health. Dr. Lujain Alqodmani is going to join for the panel discussion and speak about how we can catalyze fair and sustainable transformation of our global food systems. Dr. Edwin Castellanos is also going to offer his perspective on climate adaptation among rural farming communities, as well as climate migration in Central America. And finally, Tere Almaguer is going to offer some insights in how we could promote community health through food justice and stewardship of public lands. So thank you, and I'll turn it back to you, Arianne.
Thank you, Sheri. So before I introduce our first speaker, I encourage our viewers to ask questions through the Q&A tool in Zoom, which should appear at the bottom of your screen. After the panel presentation, later in the session, we have some time to discuss the questions that have come in. To introduce you to our first speaker, Dr. Ram Ramanathan is a distinguished professor of atmospheric and climate sciences at the University of California, San Diego, and UNESCO Professor of Climate and Policy at the Tere University in New Delhi, India. He discovered the greenhouse effect of chlorofluorocarbons, the CFCs, and led the first international assessment on the climate effects of non-CO2 greenhouse gases. He has won numerous awards, including the Tyler Prize, which is the top environmental prize given in the United States, and the Champions of Earth for Science and Innovation, the top environmental prize from the United Nations. He now leads a UC Climate Solutions effort, directs a project to characterize and mitigate environmental impacts of black carbon, ozone, and methane in rural India, and serves on Pope Francis's Council for the Pontifical Academy of Sciences. Welcome, Ram.
Thank you, Arianne, and I want to thank you as well as Dr. Sheri Weiser for arranging this important discussion. I love Sheri's slogan of climate solutions or health solutions. I'm going to give you some example of that. So my title, I say that it's climate disruption. That is now a scientifically acceptable term because 4 years ago, meteorologists in the US and particularly the American Meteorological Society looked at all the data we had on weather and in a statistically significant way linked to the weather extremes, such as heat waves, fires, storms, blizzards, to global warming. So our climate, indeed, it has gotten disrupted. And that link between warming and extreme weather brings public health effects directly linked to climate change. So to me, that this is on the one hand, it is disturbing, it is sad anytime human health is involved, but it also poses an opportunity to find a solution to the problem. So why is that? You know, the science is settled, at least 10, 15 years ago, we settled the science that the pollution of heat trapping gases warms the climate. And we also have numerous solutions, technological solutions, ecosystem solutions, societal transformation. So the question is, why are we not implementing them? Simply because we don't have the sort of massive public support we need worldwide. And in America, well, the country is divided, right? So we are finding it hard to enact the solutions which we have on hand. So I think pivoting to public health opens up a new opportunity for getting that massive public support. So I said the climate has got disrupted. Let me just share you in the next two slides, two pieces of data. I'm showing you here, starting from 1880 to now, ocean temperatures in the blue and the green, tropical ocean, global ocean. In 2014, that's just 6 years ago, the global ocean temperatures exceeded the temperature of the hottest climates we have experienced, which was about 120,000 years ago. It's a period called interglacial. The Earth goes through warm and cold epochs. So we exceeded that ambient temperature 6 years ago, okay? So you can ask, so what? It's just one record we have beaten. And what we have found is that numerous places on the planet, at least 10 of them, regional hotspots are showing up. I'm just showing you something close to your home, Northern California. If you look in the top one, the summer temperature just in the 40 years has increased by 3 degrees Fahrenheit, and water is evaporating at an alarming rate. The evaporation of water from the trees, from the soil, and from your skin, all of that has increased by about 20% because of this warming. And the warming has, disrupted the precipitation in unbelievable ways. Just taking again your Northern California, your fall rain season has shrunk by 27 days, and the rainfall has decreased by 25%. That is the reason things are drying out and forest fires are, are increasing astronomically. How astronomical is that? That is shown in the last graph on the right-hand side. Again, we are starting from 1970s to now. Last 10 years, fires have consumed 11 million acres, the last 10 years, compared to about 1 or 2 million 30 years ago. So why is that such a big deal? The total forested area of California is 33 million. So just 1/3 has been exposed to fires, okay? The loss of the 2018 fire alone is about $150 billion. And let me just touch on the health effects. This is a study was done at UCSD. Dr. Jyoti Mishra, she's a neuroscientist, and she worked with a team of people in Northern California. This is the Camp Fire, the worst disastrous fire we experienced in 2018. There are 3 categories she examined: post-traumatic, stress syndrome, PTSD. Then the next one was the major depressive disorder, MDD, and the third one is the generalized anxiety disorder. So comparing the 3 population, on the left-hand side is not exposed, the gray is indirectly exposed, and the hatched is directly exposed. And what she found were these mental disorders increased in intensity by nearly 50%, just one fire, okay? So what's ahead of us? So let me just touch on just briefly. We published a study in Nature 3 years ago in which we showed the 1.5 degree warming. I mean, it's a unit of Celsius. The planet as of 2014 has already warmed by 1 degree. And we concluded it's going to warm by another 50%. So that's going to happen 9 years from now. That is, by all accounts, the threshold beyond which we go into dangerous climate change. I have personally gone on record predicting that when that happens, that's 9 years from now, climate change like COVID will move into our living rooms. So I always look at the positive side. There will be massive public demand for protecting our health. Protecting our health by building resilience and protecting our health by mitigating the changes, okay? So just look at what happened in the last 20 years, 2000 to 2019, compared to the 20-year period, 1980s. Number of weather-related disasters have almost doubled from 4,200 to 7,350, and the deaths have increased by about 40,000, sorry. And then the displaced have increased by nearly 1 billion people. Okay, already we are seeing massive effects, and the economic losses from this was close to about $1.3 trillion. So this is how, the fundamental culprit here is fossil fuel combustion. But fossil fuel combustion also releases air pollution, which in the 20-year period has killed 140 million deaths. So just echoing what Dr. Sheri was saying, climate solution is a health solution. So if we replace fossil fuels with renewables, not only we avoid all these disasters, we would save about 140 million premature deaths from just air pollution, okay? So keep that in mind. Because of all this, I'm a member of the Pontifical Academy of Science. With Pope Francis' support, I organized a meeting of, of health experts from around the world. I teamed up with the WHO, and we published this book. It's an open source book in which we concluded climate change poses an existential threat to Homo sapiens. This existential threat is not 200 years from now, not 100 years from now, but somewhere between 40 to 50 years, when the warming would exceed 3 degrees Celsius if we don't do anything about it. We're going to pass the 2 degrees Celsius just in about 20 years, okay? What does that mean? These are the estimates. 1.5 billion would be exposed to deadly heat. 600 million would be exposed to vector-borne diseases. These are, disease carried by mosquitoes and other, vectors. The most serious thing here is widespread droughts. I don't know how many of you know, California is going through a mega drought, and it's going to get worse. And we are one of the most food-producing states in the world, right? We export tremendous amount. I personally don't see, having seen all the records of rainfall decrease, how California, particularly the Central Valley and all regions south of Sacramento, I don't see how our agriculture is going to survive if they continue business as usual. Water shortages alone, leaving alone the fires and other things, is going to be oppressive for our agriculture. And we expect mass displacement and migration. I don't know how many of you know, there's been published studies, 2 of them, one in Proceedings of the National Academy of Science, linking the Syrian migration issue originally to that part of the world becoming drought prone. So rural people migrating to cities and the cultural clash sort of lit a fire to the whole situation. So this is particularly for us here in our border, where we're expecting Central America and Mexico to dry out. It is very disturbing to think about probabilities of migration, okay? So we're just switching to solution. The first thing I see is that we need massive education. I'm proud to say University of California has already started an education protocol with the target of educating 1 million climate warriors. This has a digital textbook, videotape lectures, and a MOOC version. It's being taught in many campuses of UC, at least 6 or 7, and we are taking it to the rest of the US and the world. I want to conclude with this. This is solutions, 50 of us in the UC system, we came up with these. It includes things like governance, market mechanism, technology measures. But at the top of our solution set is societal transformation. From UCSF, Dr. Gina Solomon was part of the authors here. And under the societal transformation, we targeted two issues: impact on public health and climate justice. Thank you.
Thank you, Ram. Very insightful. Next, we will hear from Dr. Samuel Myers. Sam is a UCSF-trained internist and a principal research scientist in the Department of Environmental Health at the Harvard T.H. Chan School of Public Health. He is also the founding director of the Planetary Health Alliance, a multi-institutional international effort to understand and quantify the human health impacts of disrupting Earth's natural systems and to inform policy and resource management. Welcome, Sam.
Thanks, Arianne, and thanks to the organizers. It's really actually wonderful to be back, even if it's virtual at UCSF again. And I only wish I could be there and be meeting you all in person. Sheri asked me to speak a little bit about climate change and nutrition and food systems. And I sort of begged her indulgence to broaden the frame a little bit and introduce you to this really very rapidly growing and highly interdisciplinary field of planetary health. It's a field that really only dates back 5 or 6 years. I think it might be of interest to many of you. Its sort of inception was with the Rockefeller Lancet commissioned report on planetary health published in the Lancet in 2015. And since that time, we've just seen very rapid growth globally in new journals in planetary health, new courses all over the world, degree programs, the UN system embracing it as a framework for the Sustainable Development Goals, and on and on. The Planetary Health Alliance that I direct has been growing very rapidly and has over 250 organizations in over 54 countries now around the world really engaged in planetary health. Let's see if I can figure out how to advance. There we go. So the core premise of the field of planetary health is simply that the scale of the human enterprise, the collective impact of all of our combined activities now exceeds our planet's capacity either to absorb our wastes or to produce the resources that we're using sustainably. And as a result, we're seeing this accelerating transformation of not just the climate system, but all of our natural systems at the same time. So yes, we're disrupting the global climate system. We're also seeing global scale pollution of air, water, and soil. We're driving the 6th mass extinction of life on Earth. We're altering biogeochemical cycles. We're changing land use and land cover. We're seeing resource scarcity of things like fresh water and arable land. And all of these ways that we and our collective activities are transforming nature, are interacting with each other in complex ways that we're just starting to understand, but which affect the sort of fundamental core conditions for human health and well-being: the quality and quantity of air, of food that we produce, the quality of air we breathe, water quality, exposure to infectious diseases and extreme weather events, even the habitability of some of the places that we live. And ultimately, we're now seeing impacts across every dimension of human health. So certainly nutrition, but also, as we heard, infectious disease, mental health, non-communicable diseases, displacement, and conflict. And so just as we've sort of come to understand over the last several decades that human health has really important sort of social and cultural and political determinants, we're now coming to understand that it has very important ecological determinants, that in fact, human health is nested in a set of ecological biophysical conditions, which we're now changing at the fastest rates in the history of our species. And so when we hone in, for example, on nutrition, which I'm going to talk a little more about, what determines the quality and quantity of food that we consume? Yes, it's climate change, but it's also changes in arable land and things like erosion and desertification and salinization and land conversion that are reducing our arable land. Things like pollution, ground level ozone, for example, is a potent plant toxin and actually reduces crop yields, access to water, changes in the biological communities in which food is being grown. So all of these different kinds of environmental change are actually affecting nutrition. And I thought, just to give you a little feel for what research in this area can look like, I'd tell you a few very quick sort of anecdotes from our own research program based here at Harvard for planetary health research in food systems. And so we've done a lot of work in these three different areas. The first is looking at how rising concentrations of carbon dioxide in the atmosphere are affecting the nutritional quality of the foods that we consume. And what we found by pooling data that was grown over, these are 6 staple food crops that were grown, 41 cultivars of 6 food crops grown on 7 locations on 3 continents over 10 years. So a big sample size in which we grew crops that elevated CO2 inside these rings of what are called face rings of carbon dioxide emitting jets. And so you can maintain the CO2 inside these little circles at a prescribed level, in our case, 550 parts per million, which is where the world will be about the middle of this century. And what you find when you do that is you can grow crops in open field conditions. They're not in greenhouses. There's nothing artificial about them. They're experiencing the same weather and soil conditions on inside and outside the ring. But the crops grown at higher CO2 turn out to have significantly less nutrients, things like iron and zinc and protein that are very, very important for human health. And we've spent the last 10 years or so modeling what that means for the populations of 152 countries around the world, and found that around 150 to 200 million people are likely to get pushed into new risk of deficiencies of those nutrients with very significant health impacts, as well as around 1 billion people who already have deficiencies of those nutrients for whom the deficiencies will be exacerbated. Another area we've been doing a lot of work, in fact, we just submitted a paper this week, our third paper looking at the decline in insect pollinators. And the paper we just submitted is looking at how insufficient insect pollinators is reducing yields of important food crops like fruits and vegetables, nuts and seeds, legumes, that actually play a very important protective role in our diets in preventing the non-communicable diseases, things like heart disease, stroke, certain cancers, diabetes. And when we don't have enough of them in our diets, we see higher mortality rates from those diseases. And we actually modeled the amount of yield that we're losing from insufficient pollination globally. And we modeled how that food would enter the global trade system and who ultimately would have purchased and consumed it and what the health effects of that consumption would have been. And we're finding about 500,000 excess deaths right now from insufficient insect pollination. And that's both of these effects that I'm talking about were completely invisible, which is sort of an important theme. They would be hard to anticipate, and they were completely invisible until we found a way to sort of shine a light on them. The third area we're doing work is in changes in oceans, and really the result of ocean warming and how warming ocean temperatures that we already heard a little bit about are actually changing the size and the distribution of fisheries around the world, and ultimately pushing our fisheries away from the tropics and toward the poles, which causes a reduction in access to wild harvested fish for people, particularly the ones who most need it in the tropics. And we found that around 1 billion people in the world are depending on wild harvested fish for really important contributions of key nutrients for their health. So those are just a few examples of ways that environmental change are affecting nutrition. And the point here is that, there's a whole universe of ways that we're fundamentally altering the biophysical conditions under which our food production system has to operate. And so I've pointed out the CO2 effect, the pollinator impacts, the fisheries impacts. We also work on wildlife declines in Madagascar and how access to bushmeat is really important in maintaining nutrient sufficiency. But of course, climate change itself, apart from the CO2 effect, has enormous impacts that have been referred to on food production and changing temperature, precipitation patterns, soil moisture, extreme weather events, even the capacity to perform outdoor agricultural labor is now in question in many parts of the world. And so there are lots of other disruptive effects of climate change. We have a growing problem with water scarcity, land degradation. We've heard about population displacement, and one of the major issues with population displacement is undernutrition, pollution, as I mentioned, and then of course, surprises, another common theme in planetary health, that if we keep changing these conditions at such rapid rates, we're going to be surprised by these sort of systemic and complex effects of altered systems. And I want to point out that all of that complexity around nutrition and environmental change is mirrored in every other dimension of human health. And we could map out just as complex a set of relationships if we were looking in these other disease spaces. And so really the sort of key, to me, take-home points are, first of all, it's not only climate change, it's everything change. That we're changing all of our natural systems very rapidly. And it's not just nutrition, it's every dimension of human health that's impacted. And the distinction matters because the answer is not only to transform our energy system and change greenhouse gas emissions, it's actually to move upstream in this diagram and think about how we create deep, rapid structural shifts in the way we do just about everything, whether it's food systems, energy systems, the built environment, the chemical industry, circular economy and manufacturing, economic accounting, it goes on. And so we really need what we've been calling the Great Transition. And in fact, we're having our fourth big Planetary Health annual meeting just in a week and a half. It's being co-hosted by the University of Sao Paulo in Brazil, but this year it will be virtual and free. And the whole focus of this meeting is how we bring communities together to achieve the Great Transition. And so it's very solutions focused, talks about private sector, it talks about governance and policy, it talks about movement building, and also has a lot of science highlights. So I invite you all to participate and join and register for the annual meeting, and also to check out the Planetary Health Alliance if any of these topics are interesting to you. And thank you very much.
Thank you, Sam. And that was a great closing. Now we will move on to our panel discussion, moderated by Sheri. After the discussion, we will have some time for questions. A reminder to please submit your questions through the Zoom's Q&A tool at the bottom of the screen. We are either answering them as they go along, or we will compile them for the end. So I'm going to introduce each of our panelists individually. Our first panelist is Lujain Alqodmani, who is joining us from Norway. She is the Director of Global Action and advisor to the Executive Chair at EAT, a global non-profit startup dedicated to transforming our global food system through sound science, impatient disruption, and novel partnerships. She currently co-chairs the World Medical Association Environment Caucus and is the International Officer of the Kuwait Medical Association. She is a physician specialized in global health and climate issues. Our second panelist is Dr. Edwin Castellanos, who is joining us from Guatemala. He is the director of the Sustainable Economic Observatory and the former dean of research at the Universidad de Valle de Guatemala. He has served on the Intergovernmental Panel on Climate Change and has received several awards, including Guatemala's National Medal of Science and Technology in 2016. He is a leading researcher in both climate change mitigation with a focus on carbon sequestration and climate change adaptation with a focus on rural communities in Mesoamerica, particularly indigenous groups and smallholder farmers. And our third panelist is Tere Almaguer, who is an environmental justice organizer at People Organizing to Demand Environmental and Economic Justice, PODER, a grassroots organization that works to create people-powered solutions to the profound environmental and economic inequities facing low-income Latino immigrants and other communities of color in San Francisco. In this role, she works to create spaces for community to reconnect with the land, grow healthy food, practice herbal healing traditions, and provide job training and create community governance. Welcome to all the panelists.
Thank you, Arianne, and we're so grateful to all of our esteemed panelists and many of you who are in different time zones right now. So I'm going to start by letting Lujain, Edwin, and Tere introduce a little bit about their work. And Lujain, I'm going to start with you. Wondering if you could walk us through some of EAT's initiatives to transform global food systems to be more sustainable in the setting of climate change.
Thank you, Sheri, and good morning, good afternoon, good evening, everyone. I'm honored to be with you here today to speak briefly about EAT and the work that we do. So EAT is a global platform for food system transformation. We break silos and connect agendas across health, sustainability, including climate, biodiversity, oceans, and social equity. So our DNA is based on three main elements. First, science, addressing knowledge gaps and synthesize evidence. Second, action, translate knowledge to ambitious action and policy asks. And then the third, engagement, engage across sectors, stakeholders, and geographies. So 7 years ago, our founder, Gunhild Stordalen, together with Johan Rockström, who's a world-leading sustainability scientist, is currently the director of Potsdam Climate Institutes, were seeking answers to simply one question, which is how to feed 10 billion people a healthy diet without destroying the planet. What could this diet be? And back then, there were no answers to that. So we partnered with the Lancet Journal and formed the EAT Lancet Commission. It convened 37 world-leading scientists to set for the first time scientific targets for healthy and sustainable diets and planetary boundaries for the food system. The EAT Lancet report was launched around 3 years ago, and it stated that in order to have a true food system transformation, we need a combined approach. First, dietary shifts toward what we name the Planetary Health diet, which is a plant-rich, flexitarian diet that is mostly fruits, vegetables, legumes, and nuts, and little amount of seafood, dairy, and meat. Second, sustainable food production within planetary boundaries in relation to climate change, land use, water resources, biodiversity, nitrogen and phosphorus cycling. And third, having food waste and loss by 2030 in accordance to the 2030 agenda. In order to achieve that, the Commission had 5 recommendations. First, seek international and national commitment to shift towards healthy diets. Second, reorient agricultural priorities from producing high quantities to producing healthy food. So moving from quantity more towards quality to increase high quality output. And fourth, strong coordinated governance of land and ocean, and at least half food losses and waste. So following the EAT Lancet launch, we had several initiatives to engage several stakeholders, such as cities, for example. So through the EAT C40 Food System Network, we launched the Good Food Cities Declaration, where 14 cities have committed to planetary health diet for all by 2030. And this to be achieved, for example, through their public procurement policies. And this has the potential to influence over 500 million meals a year. And lastly, together with the city of Copenhagen and other partners, we synthesized the EAT Lancet targets to be more city-specific or urban science-based targets based on the city context. So moving from global science into local context and action. And of course, we have several more initiatives working together with the private sector, financial institutions, civil society organizations, farmers, chefs, and more. I'll stop there.
Sorry about that, I was on mute. Well, thank you so much, Lujain. And I'm going to turn to you, Edwin. And I know you've been engaged in climate adaptation and mitigation work in Guatemala for over 20 years. I'm wondering if you can tell us how you've seen climate change shape the lives and livelihoods of rural farmers there, and also what role food security solutions can be playing in these communities.
Thank you, and thank you for the invitation and the interest of about what is happening in our region, particularly now that it's been making the news in your country. And before focusing on climate change, it is important to realize that Central America show structural inequalities which have been around way before climate change was observed. There are high levels of poverty, particularly in Guatemala and Honduras. The poverty rate in Guatemala is as high as 60% on average, but in rural areas, you can see rates as high as 90%. And of course, these high rates of poverty come together with other negative socioeconomic indicators like food security and child mortality. Now, climate change comes on top of all of these situations which were pre-existing. The other thing that is important to understand when we talk about farmers and agriculture in Central America is that we have two different types of farming. The US people are mainly used to seeing, for example, bananas coming from Central America in your supermarket. And bananas are produced by international corporations, Del Monte, Chiquita, and these are industrial activities that have a lot of resources and technology. On the other hand, when we talk about small farmers, what we have is subsistence farmers, people who are producing with very low or no technology, and they are basically producing for their own consumption. And these farmers are relying on the rainfall to irrigate their fields. And this is where climate change comes in, because we are observing not only an increase in temperature, but more importantly, we are observing a shift in the rainfall patterns in the region. Particularly important is that the early rainfall usually used to start in May, in June, and farmers were always used to planting in April, hoping for those May rainfalls. But especially in the last 5 or 6 years, we have seen the amount of rainfall in May, in June, diminish strongly. And so many farmers have lost their crops. And of course, the food insecurity situation gets way more complicated. Now, on top of having this situation of little rainfall in the early rainy season, we are also seeing more rainfall at the end of the rainy season. The rainy season in the region used to end in October, but now in November, we have still a lot of rain. And oftentimes what we see is that we move very quickly from a situation of drought to a situation of too much rain, which results in flooding and also in landslides. And that was very evident last year, for example, when we had two hurricanes going through the area in November. Those hurricanes were already outside the hurricane season. They were outside the rainy season. And more importantly, they were back to back within 1 week. So it was a very extreme situation that resulted in extensive flooding of many of the agricultural fields. And so what we see is that we have a situation where small farmers were already struggling to survive, struggling to produce their own food for self-consumption. And now these changing patterns of rainfall are making it more difficult for them to produce this food. And of course, this is making the food security situation very severe.
Thank you, Edwin. And I think we're seeing these patterns in many of the regions that we work. So Tere, I'm wondering if you could share with us what brought you to this work and also what you have learned about community food security solutions through your exciting work with the Hummingbird Farm.
sorry, I didn't. Hi, my name is Tere Almaguer. Thank you for having me here today. I am a community environmental justice organizer with Poder. I am the daughter of immigrants. I was born in San Francisco, and my dad came to California as a bracero worker with my grandfather. Both parts of my family, dad came as farm workers from Lagos de Moreno, Jalisco, where they were recruited because of the agricultural expertise. And so I first got politicized into organizing, into door knocking, into bringing community together. When there was this proposition 187 in the 90s that was scapegoating immigrants, undocumented folks, saying that they were the problem for all the economic downfalls of the state at the time. And I just remember, you know, delving deeper through support, community support, through gaining critical thinking and really looking at, well, why is it that my family immigrated? And then going back to Lagos and realizing that it was a Nestle corporation that literally dried up the river, polluted it, and then cut all access of water to the land where my family had been self-sustaining for hundreds of years, had been growing their food, had cattle, and they weren't able to do that anymore. And so then coming back to San Francisco, to the Mission District, where there's evidence of environmental racism and, you know, the Bayview, Hunters Point area also in San Francisco, and looking at, you know, the institutionalized racisms of putting the brunt of the solution in poor communities of color, really seeing kind of the reflections of that, right? And how our community always bears the brunt of industrialization, of what they call progress. And so organizing, we really wanted to share kind of like these critical thinking skills with youth. So I ran a youth program with Poder for about 15 years, sharing my experience as a youth organizer, and really looking at, like, you know, we love our communities, we build our communities, we grow our communities, right? But why is it that we have to share these injustices, and what are the things that we need to do to speak for ourselves, to make changes, to change, as someone said earlier, how we build in our cities, right? What gets permitted and not, right? And so one of the campaigns that we launched was the Pueblote, which brings together two words, pueblo, which means the people, and lote, which means lots. And we did extensive surveys, door knocking, community meetings, focus groups for about 3 years to come up with the people's plan. And what we found out was that people needed, first and foremost, housing, jobs that allowed for them to have a living wage in the city, that allowed for them to have benefits, to be able to take care of their families, and they needed green open space. And so that became the rest of our work. And one of the focuses that I took was really looking at green open space. One of our youth groups, because we're a member-led organization, came up with a manifesto called Sabor para el Corazón, or Flavors of the Heart. And really acknowledging that all of us, including these youth, like most of our parents were land-based and lived in ranches. And our great-grandparents lived to be up to 100 years old because they grew their food, because they ate the herbs and made their own medicine, right? And then our parents coming here to this country were diabetic, were on all these pills by the time they were 40, 50, because they were exploited workers, because they were exposed to pesticides. And so really looking at, like, the detriment of our health being connected to not having access to land, first of all, to live in, right? Always being at risk of displacement. And then two, not being able to grow our food and grow the plants that our grandmothers taught us, you know, were good for health prevention. And so we launched a campaign to open up a community farm. We did, again, another round of door knocking and extensive outreach. And we came up with 5 principles that we wanted the farm to be guided by, based on what we felt we got from community. We believe that when we heal the land, we heal ourselves. And so really wanting to be reflective of the community, our principles were, first, we needed to be governed collectively, right? We needed to collectively govern this land. 2, we needed to come from a place of restoration and regeneration, and really look towards California Native peoples as being the leaders, and how we steward land. 3, everything needed to be education and be a skill share, because there was so much knowledge that wasn't appreciated, that wasn't acknowledged, that wasn't valued in our communities, that we needed to be intergenerational, and we needed to reflect the diversity of our communities. And so we have Hummingbird Farm. We're 3 years old. We're at McLaren Park. And yes, we've been putting these principles into action with different programs and work days. And I'll talk a little bit more about that in the next question.
Great. And thank you, Tere, so much for sharing your perspective and for the important work that you're doing. And I want to also point out to the viewers that our next session will be focusing on environmental justice as well, where we could really delve into some of these issues around the sort of linkages between racial and environmental injustices as well. So I wanted to now turn to a question related to sustainable food systems, which we know are a crucial aspect of climate mitigation. So Sam, starting with you, I wonder if you could speak to some of the strengths and pitfalls of specific food system interventions, and also how a planetary health lens could help us advance solutions.
Sure. Well, it's an enormous and complex question. The first thing that we need to recognize is this really interesting bidirectional relationship between global environmental change and food systems and nutrition. So the single biggest driver of global environmental change is our food production system. And so about 1/4 of greenhouse gas emissions, but the major driver of biodiversity loss and land use change and water scarcity and a lot of different kinds of pollution come from the way we produce food and the scale of it. And then global change itself, as I mentioned earlier, is threatening the quality and quantity of food we produce. So it's going in both ways. When we think about the food system as a solution, we're really thinking about what Lujain was talking about. How do we feed 10 billion people nutritious diets without destroying the biosphere? So how do we shrink the ecological footprint of the global food system? And when I think about that question, I really break it into 3 areas where there's enormous promise. And I'm so glad we're talking about solutions, because the first part of this was a little depressing. And the fact is there's an unbelievably rich terrain of solutions across every dimension of how we live. But so the first part of it is reducing waste. So around 1/3 to 1/4 of all the food that gets produced globally is wasted. That's true in the poorest parts of the world and the wealthiest parts of the world for different reasons. And there's all kinds of stuff going on now to really significantly try to reduce food waste, including really interesting apps that connect consumers to grocers, like the Too Good To Go app in Europe, that reduce food waste. We could go on and on about that. The second dimension is diet. So like what Eat Lancet has been doing, and the discussion about what's the optimal diet for both optimizing nutritional outcomes and reducing ecological footprints. And there have been tons of analyses of that. And consistently, we hear the same thing, which is we need to eat more vegetable-based diets. The poorest parts of the world need to diversify their diets really dramatically. But in the wealthier parts of the world, we need to eat a lot less meat. And so there's a lot you can do with dietary change. And then the third part of the equation is how we actually produce our food. And within that, the key sort of concept is sustainable intensification. So we need to produce more food with fewer ecological inputs on the same amount of land without extensifying land, because we can't continue to encroach on the rest of the biosphere. And it's extraordinarily exciting, all the things that are happening in that space, whether you look at the really high-tech stuff like precision agriculture, where we have these unmanned robotic tractors moving across fields that have been leveled with lasers and that are adding exactly the right amount of fertilizer that's needed for the seed that they know was planted in one particular square meter of soil, or using robotics and artificial intelligence and libraries of images of pests and weeds and removing them physically. So there's all kinds of stuff happening in the tech sphere, but there are also things like pollinator-friendly practices, encouraging the bugs to be where they need to be so that we can increase yields through having adequate pollinators, agroecological approaches. So it's not just a tech solution, it's a really broad solution. And then there's the whole area which is really rich out there in the Bay Area of transforming the way we produce food with plant-based meats like Beyond Meat, Impossible Foods, with protein fermentation and the production of synthetic milks and eggs, which are going on out there and in other parts of the world with cell-based meat. So there's a huge revolution in how we're producing food that's going on around the world, and in many instances with enormous potential to really shrink the ecological footprint while also maintaining essentially plant-based diets that have really positive health effects.
Great. And continuing this focus on solutions, Lujain, I'm wondering if you can talk about some of the opportunities and challenges that you faced, and also balancing health, sustainability, and equity in the kind of solutions that you're working on.
Thanks, Sheri. And just seconding to what Sam has highlighted, the transformation of our food systems into both healthy, sustainable, and equitable one is the greatest opportunity and key to achieve not just the Sustainable Development Goals, but also deliver on the Paris Agreement. And one of the important opportunities coming up is that the UN has finally recognized it. In 2019, the UN Secretary General has announced that he will convene a UN Food Systems Summit as we enter the decade of action to accelerate progress towards Sustainable Development Goals. And this is one of the unique opportunities to bring different stakeholders together across levels and sectors to come up with true and systemic game-changing actions. Such agenda would balance health, sustainability, and social equity. And we're proud to say that it has been tasked to lead on Action Track 2 on shifting to sustainable consumption patterns, which is the dietary shifts to healthy and sustainable diets, and slashing food waste. But as we seek system change, it was not and is not easy, as there have been several bumps in the roads. Now, despite the growing evidence of impact of food system on climate, for example, till this date, many governments and leaders still deny the link and consider food systems don't impact nor accelerate climate change. Despite the growing numbers of hunger, undernutrition, obesity, non-communicable diseases, deforestation, the rates of greenhouse gas emissions, water resources depletion, zoonotic diseases, antimicrobial resistance, and the list goes on. In addition, there's a strong lobby of actors, perhaps even stronger than fossil fuels, that influence the decision and the policy making, including the sugar industry and the livestock industry, for example. This indeed is a challenge, but at the same time, we turn it in terms of opportunity, in terms of bringing different stakeholders together around the table, including scientists, chefs, policymakers, business leaders, farmers, civil society, youth, healthcare professionals, indigenous groups, and others to address such difficult questions and come up with solutions that are win-win, because at the end of the day, food is everyone's business.
Well, thank you for this great discussion. I want to turn a little bit to migration. So I'm going to start with, we know that our ability to intervene on the health effects of climate-driven migration is limited a little bit by our difficulties in estimating its scale. So Ram, I'm going to turn to you and ask, from a climate science perspective, why has it been difficult to use past climate-related migration as a really guide for what's to come?
Yeah, thank you, Sheri. I want to, the question you asked me is related to all the topics which was discussed up to now: overpopulation, food waste. And the first thing I need to point out, I think Edwin Castellanos said something very important, that all the issues we are talking about is already happening. So what's the role of climate change? invariably in all of them, they act like a force multiplier, okay? Just to take the California example, our forests have been burning for centuries, okay? So if you go back to 1980s and before, and look at the burn rate, and compare that to the last 10 years, the last 10 years is a factor of 5 larger. So that's the issue, okay? So the underlying issues of rural population migrating to cities have been happening. And I was born in India and lived there for 25 years. India, still 50 to 60% still live in rural areas. Mm-hmm. In the US, it's close to probably 25, 30% because people have migrated. So let me address the connecting issue here. This is what I briefed Pope Francis before he wrote his encyclical, is that 50 to 60% of the greenhouse gas emissions are done by the wealthiest 1 billion, okay? So that wealthiest 1 billion, they live everywhere. America is about 200 million, China is 250 million, et cetera, et cetera. Even in India, 80 million are in that wealthy 1 billion population. And then you take the poorest 3 billion, they mainly live in villages in South Asia, Africa, Central America, South America, etc. Their contribution, it took me a year to get these two numbers, is 5%. So when people are forced to migrate, we have to pay for it because we cost that. See, that is the issue which has to come to the fore. Who pays for it? Mm-hmm. And without addressing that, we just address, oh, these people are migrating, what are we going to do? We have to tell ourselves, we caused that problem. We not only have the moral responsibility, we have the financial responsibility. And Hillary Clinton started this. And when she was our Secretary of State, it didn't go, they tried to create a $250 billion fund. Nobody paid into that, okay? So the migration issue, I think we need to talk about displacement and migration, right? If people have to leave from one state to another, we call that displacement. That is a huge issue. And I don't know who's going to pay for all the farmers who are going to be displaced from Central Valley. Yeah. And segue migration, Central America, we are creating brochures for regional hotspots. The entire Mediterranean looks like a disaster zone, starting from North Africa. So I expect a huge increase in migration from North Africa across the Mediterranean, which is drawing into Europe. And a similar situation between South America, Central America. I don't know what we can do to stop it, but we need here a political scientist to discuss this. So it's going to be a public health issue. It's going to be a public health disaster, but we caused it. Aren't we responsible to pay for it?
That's a very important point. And Edwin, from your perspective and all of your experience working in climate-related migration in Latin and Central America, I wonder if you have anything to add.
Yes, Ram just touched on the issue of justice. And yeah, I think at the root of the problem, we have a justice and inequality situation. And like I said before, Central America is a highly unequal society. Guatemala is one of the most unequal countries in the world. So we have a high concentration of the wealth, and that results in high levels of poverty, like I mentioned before. And so whenever we talk about migration, we have to understand that climate is just one of many components of this complex situation. When a person or a family decides to migrate, it's not a light decision. It's not something that people decide from one day to the other. It's really a process of many years and many variables stressing the well-being of this family. And so the question of whether we have climate refugees is a very difficult one that I've been asked many times. But the situation is that it's very difficult to determine how much of the decision was related to climate. It could be that a climatic situation was just the final in many stressors. It could be that this family was struggling for a long time, and then an extreme event like a drought or a hurricane was just the final push for this family to decide to migrate. And oftentimes, people don't migrate straight outside of the country. Most of the migration first occurs from rural to urban areas, and many of these migrants just stay in the urban areas. We see a lot of urbanization all over the world, including Central America. And only the ones that cannot even make it in the urban areas start saving to be able to go outside of the country, because that's also very important to realize. It is extremely costly for these people to migrate outside of the country. A farmer may have to pay his income for 2 years to be able to afford the trip to the US. And so it is quite an undertaking for people to decide to migrate. And it's not something that is done or decided lightly, for sure.
Absolutely. And I think that's a very important point. But I want to pick up on what you were talking about with equity and maybe turn back to Tere to talk about some of the important equity considerations when we're thinking about health solutions and food security interventions, and specifically with your work with urban and immigrant communities.
And so many of our members have been those climate refugees from Mexico, from Centro America. One of our members was displaced from our community in Michoacan because the big avocado orchards came in and kind of like took everybody out because of the high demand of avocados. Some of our youth came because their families had been growing corn for generations, and with NAFTA and the big dump of US corn in Mexico that destroyed or that, disseminated a lot of the Mexico corn economy, which is its basis. They had to migrate, right? And so coming to San Francisco and then living in one of the most expensive cities in the world, where your family lives in a room, or maybe you don't have access to a kitchen, what are the ways in which you're able to support your family and feed your family in a healthy way, right? And so some of the things that we've been doing have been working with city agencies like the Public Utilities Commission, the PUC, SFPUC. And so they passed an ordinance in 2012 to have a priority of growing food in all their excess areas. And they're one of the highest land proprietors in Northern California. And so now we have 6 acres in which we're able to grow food and distribute to our community. Also having different workshops connecting to our ancestral foods, right? Colonization had a big part in separating our communities from life-giving foods, nutrition-packed foods, right? And having workshops when we grow, we harvest, we prepare amaranth, which was for many years outlawed. Like if you grew amaranth, you were killed. It was against. And then learning about its amazing properties and how you can make a little amaranth ball and like run for miles, and just you grew it, right? And so really having youth connect to something healthy that they are able to connect to, and not just something that you could access at a Whole Foods that's not in your community, that you can't afford, that somebody else has repackaged and is trying to sell to you, when really it's your own ancestral foods. We have grown a network that started with the pandemic called the SUN, the Stewards of Urban Nutrition Network, with alimony farms and urban sprouts, and really looking at like, how are we going to grow more food for ourselves in San Francisco and really train the next generation of youth so that we're reclaiming our economies, and really looking at growing our food, growing our plants to make our own medicine as something that we sustainable as far as a job, and that, you know, we're localizing our economies and we're not bringing in all these big trucks with all this food from the Central Valley or wherever, right? And then just really meeting people where they're at, you know.
Yeah,
you have to work a lot of jobs to live in San Francisco. So
absolutely,
figuring out what are the best ways to get folks connected to land.
Absolutely. So I know Sam has to jump off. So I just wonder if you can briefly talk, because we're talking about equity, about how some of these equity issues have featured in your research. And if you have any final comments before for health professionals on what you think they could do to take action.
Yeah, I mean, this question of equity and environmental justice is one that may be the single biggest issue that runs through all of planetary health. And fundamentally, as Ram has pointed out, the people that are reaping the benefit of unsustainable resource use are very different from the people who are bearing the burden. And the people who bear the burden tend to be people of color, indigenous communities, the poorest people in the world, and future generations. And we actually wrote a paper this past year where we looked at the work that I described to you on the impacts of rising CO2 on crop nutrients. And we statistically looked at which people are responsible for the actual carbon dioxide emissions that are going to get us from where we are today to 550 parts per million. And we asked which people are the ones who are going to suffer from iron and zinc and protein deficiencies when their food becomes less nutritious. And they're really sort of mirror image populations, and showed in a very sort of stark and quantitative way that the wealthiest people in the world are putting the poorest people in the world in harm's way. And so it is a very important element to the conversation about population growth, as Ram pointed out in the chat. It doesn't mean that addressing the size of the human population isn't important, but you can't think about it without also thinking about consumption patterns. So I think it's an issue that runs all the way through, you know, every issue in planetary health, and has to be really thought about very carefully. So thank you for having me. I apologize that I have to go. And
no, absolutely. Thank you so much, Sam, for the great comments. So I figured I would turn now to an audience question that I think is really relevant for everybody, which is really what role health systems, and particularly universities, health systems like UCSF, what role can we be playing in advancing conversations and movements around our patients and around climate change and health issues more generally? So maybe I could have each of you respond in like a minute, and then we'll have time for one or two more questions before we turn to closing remarks. So maybe I will start with you, Ram, as your perspective as a leader in climate science about how the health sector could get engaged.
Sheri, the universities has a huge role to play. They just have to take off their hat saying that we are not here to solve the society's problems. We are here to educate. And universities, particularly, let me just talk about the University of California and UCSF, since you're the health place for the UC system. We first need to educate everyone. First in our campuses, all students, I think, should be taught about climate change, and staff. And then we need to take that education to the public at large. And I think if we can do that, particularly I'm thinking if we can take that education to that part of America which has gotten divided and is having a hard time accepting climate change, instead of calling them names, deniers, this, that, and the other, we unpack climate change from the health dimension. I think more people will listen to this if the health dimension takes the center stage, and the equity issue. If we can develop a program to take it to the so-called red and purple states, I think we would have done a huge service, because the solutions are hundreds, if not thousands. They're waiting to be deployed. So that's the sad part. So the vaccines for climate change are already there. We are not just able to deliver them. I think the universities can play an oversized role in this. Thank you.
Absolutely. So I'm going to turn to you, Lujain.
Thanks, Sheri. I mean, healthcare professionals, they have like an important role to play as frontliners. Just last week, we have published a study in the Lancet Planetary Health after surveying around 4,500 healthcare professionals about their views on climate change and health. And 81% of them worry that climate change will cause a moderate or great deal of harm to people in their communities. And more interestingly, 65% state that they're already seeing impacts of climate change on health of their patients. And the majority of them feel that they should actively encourage national leaders to strengthen commitment to achieving the goal of Paris Agreement. So yes, healthcare professionals have an important role to play, not just in relation to food security, but in relation to food system transformation in general. And here are some examples. One is in relation to our daily work and the daily encounters with patients and individuals, and having a dietary assessment as part of that in terms of assess the type of diet that the individual has on daily basis, and link that with their health conditions. Unfortunately, not all medical schools around the world do understand the importance and the significance of such dietary assessments. Second, providing professional counsel, directing them to what's good for their health and as well what is good for the planet as healthcare professional, as usually such individuals, they do seek for healthcare professionals and physicians' advice. Third is in relation to change food procurement practices, the type of food and the type of meals that are served in the healthcare facilities, healthy, sustainable, with zero food waste. And then fourth, in relation to driving advocacy efforts, setting up the food-based dietary guidelines that include health and sustainability elements and demand governments to establish social transfer schemes and physical policies to make the healthy choice the default and easy choice, and ensure that health is a core element in the national climate actions.
Great. Well, thank you. And I'm going to turn to Tere to see if you have any things you would like health professionals to know and ways that you've collaborated effectively.
I think, you know, in environmental justice, we say we speak for ourselves, right? And so I think a lot of the solutions come from communities themselves. They're just a lot of times in situations where they're unable to implement solutions because of racism, because of inequities. And so really looking towards, you know, looking at some of that ancestral knowledge that communities carry, looking towards, you know, supporting communities and being able to be advocates for themselves, their health, and their communities. And I think really connecting to land is really important.
Absolutely. And Edwin?
I think that the current pandemic is really showing to everyone the connection of our own health with the health of the planet. And that is a very important realization that when we are talking about issues of environmental degradation, climate change, we are really talking about our own well-being and eventually our survival in the planet. And I think it's great to see an activity like the one you're organizing at the university. In my country, health practitioners are still too busy with other types of issues. Whenever I approach them with questions about climate change, they say, well, that's probably my next problem, but right now I have other problems. And so it is important for health specialists to start seeing this climate change problem as a fundamental problem that they will have to approach together with the other issues that they are facing right now.
Yeah, no, I could not agree more. And Thank you all for this excellent discussion. I will point out that I know we didn't get to answer all questions. Please feel free to email us with further, if we could further answer questions, and we're going to try to answer as many as we can in the chat. And I'm going to turn it to you, Arianne, to introduce Kirsten.
Yeah. Well, thank you, everybody. And before I introduce our closing speaker, I'd like to thank everyone again for attending today's session. I also want to take a moment to thank Dr. Courtney Lyles, Jessica Fields, who has been putting all the wonderful links into the chat, Jennifer Monroe, Zakaris, Naomi Baylor, Sarah Shear, and Anne-Marie Charlesworth for their contributions to all aspects of this lecture series. We are hoping that you will all take 2 minutes to complete a brief survey, which will inform our upcoming sessions. We've also taken note of what you've said in the Q&A tool. And our next and final session is on climate, racial, and health justice. That'll take place on Thursday, May 20th at 2:30 p.m. Pacific Standard Time. And the registration details can be found on the UCSF's Population Health and Health Equity website. And so now for concluding remarks, it's my pleasure to welcome Dr. Kirsten Bivens-Domingo, the Vice Dean for Population Health and Health Equity in the UCSF School of Medicine. She is Professor and Chair of the Department of Epidemiology and Biostatistics and the Lee Goldman, MD, Endowed Professor of Medicine. Dr. Bivens-Domingo co-founded the UCSF Center for Vulnerable Populations at the Zuckerberg San Francisco General Hospital and is a national leader in cardiovascular disease prevention research to advance health equity. She is the former chair of the U.S. Preventive Services Task Force and recently chaired the National Academies of Science, Engineering, and Medicine Consensus Panel on Integrating Social Needs into Healthcare Delivery. Thank you, Kirsten.
Thank you so much to all of the speakers and the panelists for such a rich and important discussion today on this important topic. And thank you, Drs. Teherani and Weiser, for facilitating these discussions and organizing this series. As the Vice Dean for Population Health and Health Equity in UCSF School of Medicine, I know that so much of the work that we do at UCSF in our research, education, and clinical missions focus on the factors that shape the health of communities and populations in California, nationally, and around the world. We're driven strongly by our pursuit for health equity and do this in alliance with our clinical partners, the community organizations that we work with, and with our public health and policy stakeholders. I'm so pleased with this discussion series on climate change and health. There are few issues more important to population health and health equity as climate change that so clearly affects all of our health by shaping the environment in which we all live, work, play, and age, and have such important implications for health equity. As we have seen today, climate change is exacerbating a global crisis of displacement and forced migration, drastically accelerating food insecurity, and through these mechanisms, structuring who has the opportunity to access good health and who does not. I'm a general internist and I practice at San Francisco General Hospital, a safety net hospital setting in the city. I'm a researcher in cardiometabolic diseases in young adults and in poor communities. And in my work as a clinician and a researcher, the links between food insecurity, social vulnerability, and the disproportionate burden of chronic diseases like diabetes and hypertension are striking. That climate change is acting on top of and accelerating these pre-existing inequities, acting as a force multiplier, as one of our speakers said today, should serve to sharpen our focus on addressing this and related determinants of health. What's particularly notable to me about what we've discussed today is the importance of thinking across multiple levels in addressing these intersecting challenges, both at the population level to address the macro changes driving climate migration and food insecurity, as well as the local community-driven approaches to environmental and health justice that are crucial to advancing health equity. As an academic health center, dedicated to advancing health worldwide, and an anchor institution to our local community, we at UCSF have an important role to play in addressing these major challenges. Through impactful and policy-relevant research on the links between climate change, migration, food insecurity, and health, through education, as many of the speakers have brought up, through advocacy and innovative partnerships promoting equitable and just climate solutions, and through embedding this broadened understanding of health into our health systems and practice. Thank you all for joining us for today's session, the second of a three-part series on how climate change intersects with health and health inequities, and how an academic health center such as ours can respond. I hope that many of you will join us for our next session on Thursday, May 20th, where we will delve deeper into the synergies between climate and racial justice movements and their promise for improving health in California and beyond. Thank you very much.